Today, using this slide, I would like to talk about one of the key issues in the healthcare system in Japan, which is the fragmentation of healthcare providers. In Japan, most hospitals have a wide array of specialization, which might sound good because it makes it easier for patients to access many kinds of specialization. However, the downside of this is that there are only a few physicians and a small number of patients in many hospitals. And it is difficult for the hospitals to accumulate the best skills and knowledge for the specialized care. Let me take an example from angioplasty. On the left side chart, we show the number of the facilities that are conducting this angioplasty in Japan. In Japan, facilities per million population for this angioplasty is 8.1, which is twice as high as that in other countries. How it means maybe the patients have better access to this advanced surgery for heart attack. However, to the right of the first graph, in the second graph, you can see the average number of patients per facility in Japan is only 107. And this is less than half of that in other countries. Now, the issue here is that if there's only a few patients in one hospital, it is difficult for the hospital to accumulate the knowledge and skills for the specialized care. This is shown on the right side chart. This chart shows a result of the study on the correlation between the number of patients for the angioplasty and their outcome. The people who conducted the research categorized the hospitals that were conducting the angioplasty into 4 groups based on the number of patients per facility. And they compared two outcomes of the surgery, which are in-hospital mortality rate and post-operative length of stay. On the top of the chart, the average number of patients are indicated. From left to right, the average number of patients for this angioplasty per facility increases. And in the 2 graphs below, we show the 2 outcomes. In the upper chart, we show in-hospital mortality rate. If the in-hospital mortality rate is lower, it means that they have a better outcome, because it means that fewer patients died after the surgery. And in the lower graph, we show post-operative length of stay. If the post-operative length of stay is shorter, this means that they have a better outcome because patients can be discharged earlier. Now, you can see the clear trend that if the number of the patients per facility is high, they have better outcome. And what this study implicates is that the more a hospital has patients, the better their outcome is. But as we discussed earlier, in Japan, the healthcare providers are very fragmented, and some hospitals don't appear to have sufficient number of patients to accumulate the best capability for the angioplasty. And actually, this leads to the recommendation I'm going to make later, that we need to facilitate consolidation of healthcare providers in Japan. But for today, I would like to stop here, and I just wanted to leave the thought with you that the fragmentation of healthcare providers in Japan is possibly causing the loss of productivity in Japanese healthcare system. Thank you for your attention, and if you have any comments or questions, I would like to happy to answer them. Thank you.